The first-pass effect, also known as the first-pass metabolism or pre-systemic metabolism, is a crucial concept in pharmacology and medicine. It refers to the phenomenon where a significant portion of an orally administered drug is metabolized by the liver before it reaches the systemic circulation. This process can substantially alter the drug's bioavailability, efficacy, and therapeutic potential. Understanding the first-pass effect is essential for healthcare professionals to optimize drug dosing, design effective treatment regimens, and minimize potential adverse effects. In this essay, we will explore the mechanisms behind the first-pass effect, its clinical implications, and strategies used to mitigate its impact. Mechanism of the first-pass effect. When a drug is administered orally, it is absorbed from the gastrointestinal tract and transported through the portal vein directly to the liver. Within the liver, the drug encounters metabolizing enzymes, primarily cytochrome P450 enzymes, CYP450. These enzymes work to biotransform the drug into various metabolites, some of which may be active, inactive, or even toxic. The rate and extent of the first-pass effect vary among drugs due to differences in their chemical properties and individual metabolic pathways. Drugs with high extraction ratios, such as propranolol and morphine, experience significant first-pass metabolism, resulting in reduced bioavailability. On the other hand, drugs with low extraction ratios, like phenytoin and verapamil, undergo minimal first-pass metabolism and have higher bioavailability. Clinical implications of the first-pass effect. 1. Reduced bioavailability. The primary clinical consequence of the first-pass effect is reduced bioavailability. As a considerable portion of the drug is metabolized before reaching systemic circulation, lower levels of the active drug are available to exert its therapeutic effects. To achieve the desired therapeutic concentration, a higher oral dose may be necessary. 2. Variable drug response. Individual variations in liver metabolism influenced by genetics, diet, and other medications can lead to significant interpatient variability in drug response. Some patients may rapidly metabolize a drug, leading to reduced efficacy, while others may experience drug toxicity due to slower metabolism. 3. Drug-drug interactions. Drugs that undergo extensive first-pass metabolism can interact with other medications metabolized by the same CYP450 enzymes, leading to potential drug-drug interactions. This may result in altered drug levels, diminished therapeutic effects, or increased risk of adverse reactions. 4. Importance of alternate administration routes. For certain drugs that undergo significant first-pass metabolism, alternative routes of administration may be preferred. Intravenous, sublingual, transdermal, or rectal administration can bypass the liver, leading to higher bioavailability and predictable drug levels. Strategies to mitigate the first-pass effect. 1. Prodrug design. Pharmacologists can modify drug structures to create prodrugs, which are inactive or less active compounds that can be converted into the active form after bypassing the liver. This strategy improves oral bioavailability and reduces the impact of the first-pass effect. 2. Dose adjustment. Knowledge of a drug's first-pass metabolism allows healthcare professionals to calculate appropriate oral doses to achieve the desired therapeutic effect. Dose adjustments can compensate for reduced bioavailability and ensure adequate drug concentrations. 3. Drug combinations. Combining drugs with different metabolic pathways can help mitigate the effects of drug-drug interactions caused by the first-pass effect. By choosing drugs that do not significantly influence the same CYP450 enzymes, the risk of altered drug metabolism can be minimized. 4. Route of administration. When a drug is known to undergo extensive first-pass metabolism, alternative routes of administration like intravenous, intramuscular, or transdermal can be considered to achieve more predictable and consistent drug levels. Conclusion. The first-pass effect plays a crucial role in drug metabolism and has significant clinical implications. Understanding this phenomenon allows healthcare professionals to optimize drug therapy, avoid adverse effects, and tailor treatment regimens to individual patients. As pharmacology continues to advance, researchers and clinicians will continue to explore strategies to minimize the impact of the first-pass effect, ultimately leading to safer and more effective pharmacotherapy.